Good afternoon, everyone, and thanks for the opportunity to introduce MegaPerceptron. And as you can see from the title slide here, what we are trying to do is predicting the wound healing outcomes with big data. And what we are is a multidisciplinary group of researchers coming up with a common goal of solving a significant problem in healthcare. So the question then is, what is that significant problem in healthcare? So we all get cuts and nicks at different points in our life, right? I can see Mike has a bandage in his finger, so cuts and nicks are pretty much common. And when we are having a normal healing cascade, you heal after a certain amount of time. But close to like 2% of the US population is unfortunate to have that normal healing cascade, and the reason is multifactorial. It can be because of their diabetic background, it can be because of vascular issues, it can be because of their aging skin, which is a fragile skin that is not going through the normal cascade of things. So there are close to like 600 million annual cases of acute as well as chronic wounds that happens in US, which burdens our healthcare system by close to $20 billion US. And on top of that, think about diabetic foot ulcers, individuals moving forward with amputations, and amputations happens every 30 seconds in US, and that becomes again a huge economic variable in the context of a burden as well. So we identified the problem here, then what is the solution for us? So as I have mentioned before, like there are a lot of individuals with chronic non-healing wounds. What are they going to do? They are going to see wound care specialists, similar to my colleague here, Dr. Jeffrey Nisgoda, who is a very familiar name in the wound care domain. So when Jeff sees a patient with a diabetic foot ulcer or a venous leg stasis or an arterial ulcer or a pressure ulcer, he does a lot of assessments, correct? He looks through the wound, he characterizes the wound, he measures the length and the depth of the wound to identify the volume. He does a lot of assessments in the context of its appearance, whether the tissue is necrotic, whether there is granulation tissue that predicts him to gauge the healing process, so on and so forth. And based upon all these manual evaluations, he determines what kind of intervention should be there in place that helps with the healing trajectory, correct? So the beauty here is that most of the assessments are done manually. So when you think that when Jeff does this versus when I do it versus when a third person in the clinic does it, there can be chances of a lot of inter-rater variability coming into the equation, correct? So the outcomes can be variable as well. So what we are trying to do here is that we are trying to automate the majority of the process that is involved with the wound assessment process. So we start with the data collection aspect of stuff, so we can automate different processes that is happening with the data collection, simultaneously automate majority of the events that is happening with the measurement, whether it is with the 2D, 3D measurement of the wound characteristics. And obviously we can provide wound care clinicians with an informed analytics which can derive them high-level assessment of the diagnostic tool of it as well. At the same time, there is no prognostic tool that exists at this point of time, which basically says that if you do A, B, and C, the wound will be healing in X amount of time. So we are using data analytics to basically derive some of the prognostic measures in the context of healing trajectory as well. So our strength comes from our proprietary softwares, algorithms, as well as data sets. And as you can see from the slide over here, we have algorithms that localizes, segments, classifies, not only the tissue type, but the classification of the diagnosis. At the same time, the prognostic trajectory of the wound based upon the body map index, at the same time, the electronic health records. So we are comprehensively looking at the wound in the case, in assessing it digitally to have this particular platform in place. Another strength of our data set is that it is a clinician annotated data set. So like many laborious hours have been put into annotating different types of images to basically feed into the machines to understand the different types of classifications that we were doing here. So everything is done in the cloud. So the interface is in the context of a cell phone. As you can see, the cell phone captures the image, captures the required data that is required for the machines to basically drive some of the processes of learning, some of the processes of predicting, so on and so forth. And at the end of the day, the machines will be providing, or the AI algorithms will be providing clinicians with an informed tool in the context of analytics to gauge the kind of prediction that is happening in the context of the wound healing. At the same time, it is a powerful tool in the context of the patient population as well, that I probably will be discussing sometime later. So we have different competition in the market, as you can see, and our product at this point of time is convenient and more affordable to use when we compare to other market players as well. We have received significant funding, especially from the UWM Research Foundation and various internal grant mechanisms at UWM. Close to like $250,000 was received in various funding cycles, and we commercially partner with various other similar players in the market as well. So what we are asking here at this point of time, we have developed a platform, but we want to scale it up. To scale it up, we are looking for close to like $500,000 for the next 18 months. So what are we doing this for? We are trying to build infrastructure, collaborate data with other individuals who basically has access to data, hire AI/ML professionals, scale, and launch the platform to the next level. And we would like to see ourselves at the interface of various other digital platforms that are considered to be the next frontier of healthcare delivery, whether it is the delivery at home, integrated care, patient-centered care in nursing homes, or real-time monitoring of wound in the context of identifying different prognostic variables as well. Thank you very much.